It's an infant health crisis affecting millions of babies every year. November is Prematurity Awareness Month. News 3 digital reporter Ashley Williams joins us with how the problem is impacting families in our communities.
The March of Dimes 2019 report card showed that Georgia received a prematurity grade of F. South Carolina isn't far behind with a D-. That means that a lot of babies are being born early. I asked an expert at Memorial Health what can be done to lower the risk. Baby Carter Vischer was in a hurry to meet his family. His mom, Jacqueline, says he came into the world at Memorial Health at just 27 weeks and 5 days.
It was a very terrifying experience.
A full-term pregnancy is between 37 and 40 weeks. Any births before 37 weeks are considered preterm or premature.
He had a very low birth weight. He was 1 pound 15 ounces and just needed to do all the normal things and learn how to breathe and grow.
Jacqueline is not alone. Here at Memorial Health, there are several other families going through the same struggles, making sure that their child gets the help that they need to give them a fighting chance at a healthy life. Experts say about 1 in 10 babies is born prematurely, and in Georgia, it's about 1 in 9 babies.
All of our babies, we work really hard to make sure that they grow and lead big, healthy lives, but they often need extra services until they've really reached their growth potential.
For baby Carter, his mom is happy to report that he's been doing very well.
Hopefully on his way home before Christmas. That's what we're hoping for.
With both Georgia and South Carolina receiving very low grades on the March of Dimes report card, Eschborn shared a little about what can be done to hopefully improve the rates of premature births.
Some of the most common problems are related to mom's blood pressure or her blood sugars during pregnancy, and those things an OB can care for and watch with mom and help treat so that we can keep baby in longer.
Memorial Health says it has seen over 1,100 premature babies in 2019. We have more advice for lowering the risk of premature births on our website. Just visit wsav.com/premature. Ashley Williams, WSAV News 3.